Arthritis never gets better with time, and so even if people are doing well with non-operative management, after a couple years it will become worse than it was before, and by then they have changed their footwear, they've tried an ankle support, they've gotten injections, and they know that the injections help a great deal, and so we're confident that's where the pain's coming from. And at that point, it's reasonable to talk about an arthritis surgery. Arthritis surgeries are very different depending on what part of the foot or ankle we're talking about. Sometimes there's replacements, like an ankle replacement, which is sort of similar to a knee replacement. It's a removal of the arthritic joint, the surfaces, and a replacement with pieces of metal and very dense plastic so that it still moves. Other times we do what's called an arthrodesis, which is a fusion. It is intentionally getting bone to grow across a painful joint so that the two bones involved become one bone. It stabilizes the joint and it removes the pain that was coming from that joint. Other times, arthritis surgery, depending on where it is and how severe it is, you do an arthroscopic bone spur removal, where you go in with a camera and you just shave off a couple bone spurs. That commonly does not make the joint perfect, but if the problem is bone spurs hitting one another, you might provide several years of good relief with a pretty small surgery.